Hey everyone, today is Thursday, February 20th, 2014, and I wanted to make a hopefully quick video because I said I would, just a little bit in regards to the insurance changes that we've had here in the States that basically started going into effect in 2014 with the Affordable Care Act and everything. I don't want to take sides one way or the other. I know there's some people that are real happy about all the insurance changes that we've had for health insurance, and there's other people that are not happy about them. A couple of the things that I think were definitely important with the Affordable Care Act is that people with pre-existing conditions, of which I'm one of, can't be denied coverage, which I think was a very important change to be made to our system. It needed to be made, as well as the elimination of lifetime maximums. When you get people with pretty significant diseases or medical issues, emergency type things, traumatic brain injuries, strokes, cancers, catastrophic type things, medical costs can really spiral out of control, and it can really break people because things become so expensive. So I think those are two of the big things that needed to be changed. Now you can discuss back and forth about how to get that done and which party, political party has the best ideas. I'm not going to get into that, but I did just want to talk a little bit about my experience and how my health insurance used to work and how it changed. Now, the big thing for me is I work in a hospital setting, and I work what's called PRN, or as needed. So I am an employee of a hospital, but I don't have any guaranteed hours. So I'm not permanent part-time or permanent full-time, nothing like that. So that works out for me because if I need to take or want to take a month or two off, I can just let my boss know that, hey, I'm not available. And of course, I run the risk of them filling in the position that I fill right now with someone else, but that is an option for me. But also for them, if census in the hospital is low or they don't need me, they just call me and say, hey, we don't need you today. So it kind of works back and forth. But anyways, the big important point for that being I don't get any benefits from my employer. So I get no health care benefits, no retirement benefits, nothing like that. Of course, I don't need vacation benefits because I can work or not work as I need. So because of that, I had to purchase my own insurance. And in I think it was 2004, 2005, and I moved to Chicago from Michigan. I had what was called COBRA insurance, which is kind of a carryover insurance. At the time, I think you were allowed to have it for 18 months after you terminated your employment. So I left my job in Michigan. I had COBRA insurance for about 18 months. Well, of course, I paid monthly for that. And then I had to go out and get my own health care insurance. So when I was looking for insurance, of course, I had my colitis diagnosis, and I was denied by Humana, Blue Cross Blue Shield, and I think United Healthcare was the third one. But each rejection I got from the insurances because of my pre-existing condition gave me another letter that said you should check out this insurance program that the state of Illinois has. So it was called the Comprehensive Health Insurance Program, or they abbreviated it CHIP. So not every state has that. It's just something that Illinois had happened to have, and it's for basically people with pre-existing conditions. So I was able to get my insurance through them. And it was actually administered by Blue Cross Blue Shield, but the people I paid was the state of Illinois. So it was actually really good coverage. Most recently, that coverage ended December 31st of 2013 because of the Affordable Care Act and insurance companies no longer being able to deny you coverage based on pre-existing conditions. I basically had to leave that pre-existing condition insurance behind and go out and get new insurance. But as of last year, my insurance was, I paid quarterly about $1,200, so it was about $400 a month I was spending. I think it was $410 to be exact, per month. And I had a $1,000 deductible each calendar year, which means my insurance would not kick in at all for the first $1,000 of my medical bills each year. I was responsible for those first $1,000. After that, my insurance would cover 80% and I would be responsible for the next 20% for another $1,500. After I met that $1,000 deductible and the $1,500 for a total of $2,500 out-of-pocket maximum per year, my insurance covered at 100%. So of course, like if you look back at my old videos when I talked to you about Remicade and how expensive that was, it ended up being relatively cheap for me overall. I think per year I spent about $7,000 on my health care, and that's with my deductible, my out-of-pocket maximum, and then my monthly premiums. So when I look back, like I said, at the money I had to spend on Remicade and then the money spent for my 3 surgeries, it was definitely well worth it to have the insurance. So once January 1st came and I had to look for new insurance, my plans, of course, changed. And they talk a lot about the government website where you can go and look for insurance, the marketplace type thing. And I know they were having a lot of trouble with the website when it first went up. I'm assuming they've worked some of the bugs out. And I tried to get on. There were some issues. And then I talked with a couple other insurance agents because I contacted Blue Cross Blue Shield, Humana, and another company directly. And they said you really don't have to go through the government website unless you're wanting to try to get the government credits to help pay for your health insurance. And I found out that the cutoff for a single person, your income had to be, I think it was below 45,000, maybe 30, somewhere in there. And I already knew that I made more than that, so I was not going to qualify for any tax credits to help pay for my health insurance. So I didn't even go through the government website. But when I was able to get on it, I did notice it was set up very nicely for you to be able to compare plans. They talk about the gold, silver, bronze, platinum, that sort of thing, and what's covered and which doctors are included. You can research that. It does take some work. I mean, you really need to know what you spend in healthcare because that's really going to determine how much of a deductible you want to have, how much out-of-pocket max you want to have, and then your monthly premiums. So I was able to kind of compare what I did have with the CHIP program with what I was looking for, knowing that, knock on wood, I'm not going to be having any major surgery or anything this year. So I did have to take into consideration every year I have an MRI done on my liver, and then blood work associated with that. So I ended up going with Blue Cross Blue Shield, and the plan that I found that worked for me actually has a, I think it's $1,000. Yeah, it's a $1,000 deductible again. But then after I meet that first $1,000, I'm responsible for 20% of the next $2,000. So after the first $1,000 deductible, insurance kicks in for 80%. I kick in for 20% for $2,000 more, for a total of $3,000 out-of-pocket max per year. After that $3,000 is met, my insurance will cover at 100%. My monthly premiums for that are $390. So I'm actually saving $20 a month in premiums, but my out-of-pocket max went up from $2,500 to $3,000. So it's kind of a wash as far as I'm concerned. One of the big things is that the new insurance will cover preventative care, for example, like well visits and physicals, things like that, which my old insurance didn't cover. One drawback is my old insurance. If I wanted to go to the Mayo Clinic in Rochester, Minnesota, and I'm in Illinois now, my old insurance did cover that. My new insurance will not cover that. They don't have, when I talked with them, they said there's no insurance that's really going to cover out-of-state visits. If you want to go out of state to a specialty place like Rochester for the Mayo Clinic or the Cleveland Clinic or somewhere out of state, that would fall out of network, and so your deductible and out-of-pocket max all is usually doubled and then starts over again. So it can become more expensive. So that is a drawback if I decided I wanted to go to Mayo for some reason, if something comes up with my liver disease or something. I'm not too concerned about it right now. I'm very comfortable at University of Chicago with the way they're managing my liver disease and monitoring it. So we'll just kind of wait and see how that goes. And I think things are going to be changing. There's a lot, I think, of bugs to work out as things progress with this insurance and finding out what works and what doesn't work. So each year, you can look at your insurance again and figure out, do I need to change plans or not? So I just wanted, like I said, I just wanted to touch base on what had happened with my insurance and my experience with it. And you really do need to know specifically what you probably are going to spend each year so you can figure out the best insurance for you so you're not wasting money. Sometimes it does come down to figuring out, do I want to pay more up front and have to pay less later, or pay less now and pay more in the future if I'm not sure what's going to come down the pipe. So just my 2 cents worth of experience with the insurance issues. I have one more week left on my antibiotics. Last week I had talked with you about my pouchoscopy, and the doctor had found a little bit of pouchitis. So I'm 1 week into my antibiotics, and so next week after I finish my 2-week round of that, I'll touch base with you again and let you know how things are going. Just to let you know, things seem to be improving. I didn't even realize I had pouchitis. I assumed, not having a pouch before, that the way things were going was normal for having a pouch. And now that I've been on the antibiotics, I'm finding out that things could have been even better sooner along the road. So like I said, I'll talk more about it in a week after we get 2 weeks under my belt and things have leveled off a little bit more. So that's it for now. Take care.